right, today we're going to talk about how to find a trainer. Of course, you want to find someone that is compatible with your needs and someone who understands any limitations that you might have. The problem that we run into is finding a good trainer sometimes can be a little bit difficult. So let's figure out how to do that. Okay. First of all, understand that there is a vast difference between a certified personal trainer who has the proper education and experience. Let me qualify that real quickly, versus a gym employee. Okay. Most gym employees are hired by the gym, the owner of the gym, or the manager of the gym, to help clients understand how to operate the equipment. They've been shown the safe and proper way to set the seat or pick the weight or move the arms around or that type of thing. But they are not qualified to give you much more information than that. Okay. So if you want to know how to do the lat pull down properly, they can show you how the lat machine operates, but they may not be aware of the little nuances to make a pull down effective and safe. So there's that. A orientation as you walk into a new gym, and the trainer with their little polo shirt and their enthusiasm comes and wants to show you how every machine operates. That's for their liability. The gym's liability is lessened if they can show that you were educated somewhat in how to operate the equipment safely. That way, if you get hurt, that's on you. Okay? So there's that. All right? Now, someone who possesses a piece of paper that says that they're a personal trainer or a fitness trainer or whatever varies greatly in what it takes to get that certificate. So they can all call themselves trainer in the way that, what do you call the valedictorian of the medical school, medical college? Well, doctor. What do you call the person who graduated dead last in their class? They're doctor too. So which doctor do you end up with? You may not even know. And same way with trainers. You may not know the extent of their professionalism, the extent of really how much they know. And don't forget, we don't know what we don't know. So someone could be operating a business as a trainer with really walking through the ignorance of not knowing what they don't know. So they can't share that with their clientele. And also, when something rears its ugly head, like some disease process or an injury that they're trying to work around, if they don't really understand how to do that, the potential to hurt the client goes up. Okay, so just like the doctors with their Hippocratic oath, do no harm, we want to do no harm. We never want to put a client in a situation where the potential for injury or, something bad happening to them during the exercise, we want to minimize that at all costs, okay? And a professional trainer will be sure to do that. Someone who is constantly saying you can lift more weight, you can lift more weight, they may be trying to motivate you to stimulate the muscles a little bit more, or they might just be a meathead that doesn't know any better, thinking that you have to lift heavy all the time and setting yourself up for injury, and you've placed literally your well-being in their hands. Okay, so let's make sure that we understand the difference. And you would do that in an interview of sorts. Now, when I say that, A good professional trainer will give you a free consultation to sit down with them, go over your goals, go over your level of expertise, experience in the gym. Have you ever picked up a weight before? Have you ever jogged 10 steps before? Are you a marathon runner? All of those things make a huge difference in how we train the client, of course. So you want to interview them as much as they are interviewing you. So we're going to start with their education. There are, and I hate to say this, there are organizations that will provide a certificate of completion, or however you want to put it, making someone a certified trainer in 4 weeks. Some are less than that. Well, if let's say I work for a lawn company and I've been mowing yards and I get laid off from the lawn company and I decide, I think I want to be a trainer. I dropped out of high school to cut grass, and but boy, that sounds like something I'd want to do. And I bet I could make money doing it. So I'm going to go online and find a place that doesn't require a whole lot of time and effort on my part. They're going to send me the packet. Everything's done online. I can print out my own certificate when I'm done and hang it on the wall. How much do you think that trainer knows? Even if it's a very comprehensive course, if you can do it in 4 weeks, it's not that comprehensive, right? And you can learn a little bit about a lot, but not a lot about anything. Okay? So from an education standpoint, and I'm not on here to sell myself. I'm not on here to even try to get more clients because I don't have room for them right now in my schedule. I'm here to give an example using myself as someone who is qualified so that you know what it looks like. Okay? When it comes to education, I have my college is pre-med. I have, when I became a certified trainer, it was a very, very extensive program. And it was correspondence of sorts, as back in the late 90s. And I would have to send things in, and they would grade them and send them back. And my final packet that had to be completed with my proctored exam and everything was about that thick. Then I finally got a certificate in the mail saying, of course, that I had passed with flying colors and I could call myself a certified fitness trainer at that point. I also have sub-certifications. In other words, since I've become certified, I've taken more and more courses to get these little additional classes in, so to speak, in sports nutrition, pre and post pregnancy, and treatments for the low back issues that people most frequently have. So again, we as trainers, we never, ever, ever diagnose a patient or client with anything. They're not patients for us, they're clients. We don't diagnose anything, and we certainly don't prescribe anything like saying, you should be on Tylenol, or you should be on ibuprofen or Advil or Aleve or, whatever for your back pain. We never, ever, ever do that. And if your trainer ever does that to you, find another trainer, because they're operating well outside their scope of practice. We'll talk about that in a minute. Okay. So we're not doctors, but some of us have worked for doctors as well, which is where experience can come in. Now, also part of my education has been, as a learning what it took to become a physical therapist for a chiropractor, and working as a surgical assistant for dermatology and otolaryngology. So I have probably more education than most. There are people who go to college to become a trainer, and they get a pretty good package out of that. That's different as well. If they have a biology degree, you can pretty well bet that they understand the human body too, along with just how animals on this planet operate, and we happen to be one of those animals. So again, it depends. If they don't have any of that, it doesn't mean they can't be a good trainer. But again, what is your frame of reference if you don't understand the Krebs cycle? And the Krebs cycle has to do with how energy is produced in the muscle for contraction. The actin-myosin bridge, which is how the filaments of muscle slide over one another to actually form the contraction. What is the stretch reflex? Things like that. So the physical action of muscular contraction, if you don't even understand that, you're going to have a hard time being a trainer with safety in mind and the well-being of the clientele. Okay? So be wary of the 4-week certification if that is their only form of education. Let me put it to you that way. Okay. The next thing, of course, is experience. Now, I personally have been lifting weights for 45 years. I started with my father at the age of 12. My dad was a professional wrestler. He was world's light heavyweight champion from 1962 to 1980. And he took his physical appearance and health very, very seriously. And we always had weights at the house, a gym out in the backyard, in a building in the backyard, as well as my dad being, a gym owner along the way, owning a gym called Health World. He managed the swim and trim salons. I used to call them figure salons for women here in Central Florida, things like that. So my dad, who had a tremendous amount of experience and self-taught with his education, he would read Grey's Anatomy just for fun, was able to impart upon me that experience at a young age. So, how many 12 and 13-year-olds do you know walk around with muscle magazines in their backpack for school or their book bag? Well, I always had a Muscle and Fitness or a Iron Man magazine or a Flex magazine, reading the routines of the bodybuilders of the day and the stars that were known for their fitness levels, like Chuck Norris and Sly Stallone and guys like that. And I knew Lou Ferrigno's arm routine. Lou Ferrigno, of course, famous for playing the Hulk in the television series there in the late 70s. I knew his routine for building big arms when I was just a little guy myself. And I always was taught by my dad proper form, what muscles are being worked by what exercises, and, for development and, again, strength, functional strength, being able to pick something up or hold it, as opposed to just picking up a weight for the sake of lifting that weight. In doing so, I've really never been injured doing any of my weightlifting endeavors. And I've even trained for powerlifting events and things like that, and fairly injury-free. I do have some nagging little things that over 45 years, your shoulders are going to get a little creaky, your knees are not going to be as smooth as they once were, but that's understandable as well. So on top of that education, I've already alluded to the fact that I worked in medicine. So I worked for a chiropractor right out of high school, actually, while I was going to college, and was taught the physical therapy modalities like the galvanic stimulation, ultrasound, heat and ice therapy, cryotherapy, traction, all of those types of modalities that a chiropractor might use to help his patients after a car accident or, coming back from an injury, that type of thing. So I had the experience there. I had the experience moving on with more education, become a surgical assistant in dermatology and in otolaryngology, or ear, nose, and throat. I held hospital credentials. I could go in and operate with the doctors. And assist in the surgery, not just hand them instruments, but actually get in there and do parts of the procedures and retract and things like that. So the understanding of anatomy becomes very, very important if you're in someone's throat, for example, doing a thyroidectomy. So my sharpness, if you will, for my anatomy, I've kept it up because I've always been doing something that makes me think about it. If I took an anatomy class in 1989 and today decided to do something related to that, you can see there'll be a lot of gaps in my memory because I hadn't done it for so long. But since I do it almost every day, everything stays pretty fresh when you do it that way. So there's where experience comes in as well. The other thing about experience is when you're training people, the more people that you train over the years, and I've been training people, for 30 years or more, starting in the early 90s, so 35 years of training people. And the more you train people, the better you get at training people. Okay, so there's that. More of my education and experience come from taking first responder classes and paramedic emergency medicine classes, things like that. So, I've always stayed in it. I stay current with all of my education. If something new comes out in a study, I can decipher that study. That helps. And, determine if maybe it was, a study with 10 untrained college students determining if, leg extensions will develop the quadriceps. Well, that is not a very good study if you're trying to determine if that exercise helps that many people, because you have a very narrow band, age band there for college students. If they're untrained, anything you do is going to elicit results. So you have to look at stuff like that. So that's my point, is having the education and experience to even know if the modern science makes sense. Okay? If someone comes to you, or if you go to a trainer or they come to you and say, hey, I'd like to train you, and they say, but you're going to be my first client ever. Everybody has to start somewhere. And just understand that they are probably learning some of this as they go. And you have to take that into consideration as well. Some people are natural at it. Some have waited, by the way, until they are absolutely confident that they can work with a client and have been training on their own for themselves, studying, just learning everything they can on the subject. And they'll probably do a pretty good job. It's just that the more you work with people, the better you get at working with people. Okay? And that's why we talk about scope of practice. Scope of practice is working within your level of education and experience. If I had an MD after my name, I could prescribe medicine. I could do more by telling my people, you've got to do this. Okay? That's a prescription. Even if I say, if you eat more pineapple, the digestive enzymes in the bromelain that's contained within pineapple will help with your digestion. Technically, that's beyond my scope of practice if I hadn't done more studying in the course of sports nutrition. Okay? So we're not nutritionists or dietitians where we use food and things like vitamins and minerals to help diagnose or treat a disease. Okay? If someone comes to me and they're bulimic, I have to be very careful, because technically that's a condition and they need to be cleared by their doctor, and they need to be treated by their doctor for the bulimia, not by me. Okay? Things like that. So we don't want to operate outside our scope of practice. If you come to me and you're a type 2 diabetic, I understand what that is. I understand how exercise can influence your diabetes for the better, usually. and what to look for in an emergency capacity if you go hypoglycemic and pass out or something like that. Someone who doesn't understand what type 2 diabetes is and the consequences, good or bad, of exercise while you're doing it could be ill prepared if something bad were to happen. So you want to make sure that when you're interviewing your trainer, that they are aware of conditions that you may have, and you want to make sure that they understand what those conditions are. If they can't tell you what that is, the diabetes is type 2 diabetes is where your body's insulin is not being utilized properly for the distribution of sugars in your system. It doesn't necessarily mean that your pancreas isn't producing enough. It just means that it's not efficiently utilized. A type 1 diabetic doesn't produce the insulin. We need to take that exogenously or from the outside. Things like that. Those are things that you want to keep in mind when you're talking with someone. If they can't provide you with enough information that you are comfortable, that you are in safe hands, consider them to be operating outside their scope of practice, and you want to go with someone else. Okay? If someone comes to me and they say, my doctor just said I have liver cancer, okay? And, I think that if I just work out a little harder, I don't need to have radiation. That's an extreme case. But if I tell them, well, of course not. If you work out harder, you never will need radiation. That is so far beyond my scope of practice, it's comical. Not that cancer is comical, but that it would be so ridiculous for me to say such a thing. Okay? So keep scope of practice in mind. If they feel like they're doing something that is beyond their capabilities, it probably is. Okay? If they tell you that if they do this around your head, that they can tell what your aura is doing, or that, clearly your chakras aren't lined up because, you're having all these digestive issues, are they qualified to do that? Can they explain how that is actually doing something? Those type of things, okay? Another way to find a good trainer is through referrals. So ask your friends and family, oh, you trained with someone for that wedding, did you, Mary? Oh yeah, he got me down where I could get into that dress, no problem. Okay, so there's things like that, okay? More than likely, if someone has something good to say about their trainer, they're a good trainer. And again, they may have less experience or less education, but yet they still know what to do and how to do it to get you the results that you're after. And if someone else can say, Bob Smith worked great for me, well, then call Bob, okay? And give him a chance to help you too. And then, of course, there's their personality. There are boot camp instructors that think that they have to scream and yell and push and push and push. Come on, give me two more, come on. You may not respond to that. You may want that. And a quiet trainer that goes, okay, 2 more. Okay, that looked good. All right, go ahead and put those down. That may not be the drive that you need, okay? So make sure that their personality matches your personality. Most people don't like to be yelled at. Most people don't like to be ridiculed. Most people don't like to be compared to other people in the gym, although I know there are entire, types of facilities where the whole idea is to pit your performance against someone else, and they put the names on the wall and stuff like that. If that's what you're looking for, then you'll be fine there. You'll be right at home there, and those trainers will help you. If you're not, they won't. They won't be able to help you. Okay, so just in review. You want to make sure that your trainer is truly a trainer and not just a gym employee. You want to make sure that they possess both the education and experience necessary to be able to safely help you. You know, things like, do they have a CPR card? You know, those are important, right? You want to make sure that they do not offer to operate outside of their scope of practice, and that they're quick to jump in and say, you know what, we're getting into an area that's outside my expertise. I need you to go to your doctor. Okay? Or, you know, I don't see the results that you should be getting. I think you need to see a registered dietitian. Or, you know, you're getting weaker, not stronger. You need to go see a neurologist, things like that. Okay? You want to make sure that if you need to, that you're getting referrals for your trainer. So friends and family that have seen results, or more importantly, ones that haven't seen results, you know which ones to stay clear of maybe. And make sure that their personality and your personality are copacetic. All right? If they don't mesh and you're butting heads, oh, that's not going to work. You're not, when that alarm goes off at 5 a.m., you're not going to rush to go down there to start your session, because you can't stand this person, and you're not going to go out of your way to get there on time and things like that. All right? Also, one last point, don't forget, motivation does not come from external sources. So your trainer can be motivating, but they are not your motivation. Your motivation comes from inside. You have to figure out what drives you to keep pushing forward to see the results that you're looking for. All right? If not, you know, you could decide tonight to eat a pint of Haagen-Dazs ice cream that totally is not part of your nutrition program, because you're not motivated, not because I said don't eat the ice cream. Okay? So keep that in mind as well. All right, so we'll cut it right there. And if you're in the market for a trainer, this will help you find one that maybe you can stick with and get the results that you're looking for. Have a good one, everybody. Bye-bye.